Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
This episode of Speaking of Pets podcast is sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggies clean up your ponds while the golfers clean up their game.
Hey everyone, welcome to Speaking of Pets. Have you ever had problems giving your pet medication? Janet, I know you have with those cats of yours. Well, you've come to the right place. We are lucky enough today to have Dr. Ray Hutchins, who is the inaugural chief veterinary officer of Wedgwood Pharmacy. Now, for those of you who don't know what Wedgwood Pharmacy is, they specialize in individualizing medications for your pet. You have a cat that can't take an oral med, chances are they can make it into either a liquid or what we call transdermal, something that the medication is absorbed across the skin. There's a lot of thought and work into doing these compounds, if you will, and Wedgwood is world famous for their ability to get these meds into your pet. Darn it, we'll do it. And not only dogs and cats, which we'll talk to Dr. Hutchins about. I can't wait to ask her about all the different species. A little bit about Dr. Hutchins. She's a board-certified veterinary internal medicine specialist, small animal. She is a DVM graduate of North Carolina State University, with our friend Dr. Ed Breitschwert. Shout out to Dr. Breitschwert out there. We've had him on the podcast. And not only has she worked seeing patients, but she's also managed several veterinary hospitals in her career as well. What I love is all of us vets somehow volunteer our time. And she volunteers for Waggle, which is a nonprofit that helps pet owners that are financially strapped try to get the means to treat their pets. And thank you, Dr. Hutchins, for that. So welcome. We can't wait to find out all about Wedgwood Pharmacy and what they can do for our pets so we can get those meds in them.
Thank you for having me. I'm really excited to be here. Always happy to help anyone understand how to solve challenges in medicating their patients and making sure that our pets are getting the care that they need. So really happy to be here. Thank you for having me.
Janet, I know you have questions because Janet wasn't familiar with what she even asked me before the show. Well, what does a compounding pharmacy do? So, Janet,
What does a compounding pharmacy do?
That is a great place to jump in. I think there's a lot of confusion around that. You know, I think a lot of people think that compounding is something that is not always done in the most scientific way. And while that can be true, I'm here to tell you that there's also a lot of science that goes into excellent compounding. A lot of people, most of the background that they may have on compounding is from the news or experiences that they may have in human medicine and in human pharmacy. In veterinary medicine, a lot of that is similar, meaning that the veterinary compounding pharmacies are highly regulated, just like they are in humans. But the big difference in veterinary medicine is the reason why compounding is used. So if you think about veterinary medicine, we are often treating all kinds of different animals, all kinds of different species. As a veterinarian, I would go into one exam room and see a tiny chihuahua that I could hold in one hand. And then I would walk out of that exam room and walk into another one with a giant breed dog that is very different in stature. And so we're faced with those challenges all the time. Additionally, we often are treating conditions in patients where the FDA approval process for the medication was not studied or not included. And so a lot of time, especially in sick patients, we are using medications extra label or off label anyways, which means that there's a lot of medical or clinical necessity and compounding for veterinarians. And so it's important to know that those high standards of regulations apply to veterinary medicine compounding, but a lot of time the motivations or the clinical reasons are different. And one of the most important reasons that we compound is because or utilize compounding medications is because it's so hard to give medications, especially to cats.
It's
So
torture.
the cat ownership is on the rise, which I love. I love cats. Cat ownership is on the rise, and they are really sneaky and really challenging to medicate. And so compounding is also a tool that veterinarians will often use to just make it easier to actually get those medications into their patients.
So is compounding, and this is really very layman, like a little bit of doxycycline, a little bit of this, and a little bit of that put together?
Well, I mean, it can be that. So compounding, I like to think about it in several different ways. So compounding is anytime you are taking a medication and changing the studied form that it was in. So what that can include is actually anything from putting it into different packaging. So sometimes the different approval processes or studies that were done are very specific to the types of packaging that a medication is in. Sometimes compounding is related to combining medications, like you just indicated. Sometimes it's changing the concentration, which is really important in veterinary medicine because concentration of medications, especially if they are what we call a narrow therapeutic area, meaning that they can be really toxic if you give too much. That's important for really small patients. And sometimes it's just makes it a lot easier to give medications to a really large patient, like a horse. Yeah. And so changing concentrations is another example of compounding. So really truthfully, it's anytime you are changing the form of that medication from what was evaluated in a FDA approved study.
So how do I know if I need a compound pharmacy for my pet?
Love that question.
Usually I'm going to the pharmacy to get, usually doxycycline because we've had a lot of Lyme around here.
Yeah.
But, it's just a basic, like a human drug.
Yeah. So my answer to that is one, a compounded medication should only be prescribed by a veterinarian. So your veterinarian should be your partner in that conversation. Now, the important piece that I'll say is that this is where a pet parent or a pet owner or anyone who loves an animal that they're working with or cares for an animal, they can be an advocate for themselves and for their pet. So the veterinarian should be the one to determine if it is appropriate to use a compounded medication. That's super important. But I believe that the pet owner should be really comfortable with being an advocate. And what that would look like to me in an exam room would be when a pet owner learns that their pet needs a medication, that they would share openly with their veterinarian or their veterinarian's team and say, I have concerns about giving a medication because of these logistical challenges. They spit the medication all over the kitchen. My job impacts how frequently I'm home to give a medication. Like anything that would cause a logistical challenge to adhering to the treatment plan should be raised. And then the veterinarian could determine, is a compounded option something that makes sense in the situation, is clinically relevant and likely to help improve the outcome.
So you add, I'm assuming, these incredible tasty, delectable flavorings.
Yes.
I was quizzing Janet before we came on the air, and I asked her, what do you think the most common and accepted flavoring is for cats? And what was your guess?
Well, I was laughing. I was saying Sour Patch Kids, but I'm going to guess.
I thought you were
kidding.
serious.
I'm going to guess liver because I got that liquid stuff, that you told me to get for the cats to drink, and it's gross. But it's liver tasting. I haven't tasted it myself. Thank you very much.
Okay, are you sitting down, Janet? Because wait till you hear the answer.
I'm sitting down.
The most popular feline flavor that we sell is marshmallow, which is hilarious to me because I think marshmallows are disgusting. I mean, my kids love
I know.
It's like sugar. They're whipped sugar. Oh
Yeah.
my God.
But here's the really fascinating thing is cats cannot actually physiologically taste sweet. And our pharmacists know that. However, what it does is it masks the bitterness of the active ingredients of the medications that we're trying to give. So for any of those listeners out there that have tried to medicate a cat and they do that terrible, like just frothing,
Yeah.
sad thing where there's just like drool coming down, all
And they're
roping
pushing
down.
against you. Like,
Yes. The marshmallow flavor actually masks that bitterness so that they don't even experience that reaction. And that's the really fun thing about Wedgwood Pharmacy is we have veterinary trained, so pharmacists that have had specific veterinary training that are sitting there dedicating their lives to thinking, how do I block that really unpleasant experience that cats are having and that their families are experiencing? And it turns out it's marshmallow.
I don't want our listeners to think they can just take a pill and shove it in a mini marshmallow and hand it to the
No,
kid. Okay.
exactly. That's
Because
exactly
I'm thinking,
right.
hey, I could,
That's exactly right. Because cats actually, they don't appreciate the sweetness of that
No.
marshmallow. And the other thing that's really important that goes into the compounding is we look very closely at what is the ratio of flavoring to the active ingredient? Does that flavoring actually destabilize the active ingredient? So if there is a risk of that happening, we would not recommend that compound because you're decreasing the likelihood of that medication having the effect that you intended.
Okay, so what's the most popular for canine, for dogs? And
Oh.
then my other question is, a horse pill must be huge.
Yeah, so in the canine, actually the more popular flavors, they do also like marshmallow, but interestingly, they tend to respond really well to a lot of the more traditional meat flavors. So chicken, liver, those are really, really common. The important thing about all of the meat flavors that we utilize at the compounding pharmacy is that we're also really careful to make sure that there's no meat protein allergens in our flavors. So that's another important difference. If you have a dog with a meat allergy and you just take that capsule and shove it in a chunk of chicken, they would be exposed to those allergens. We make sure that that's removed as a part of the process. And for horses, apple flavor, molasses, those are the big common ones. Cricket is one of our most popular flavors because we serve a lot of reptiles and avian. And so we've got some pretty disgusting flavors. And we know they're disgusting because at a very large veterinary conference, we just had a flavor shot bar, and you got to come and decide if you knew what the flavor was. And that was a highly entertaining experience.
Oh. Janet, that would have been a fun meeting to go to for us.
I had a friend that worked at Pepperidge Farm. She actually developed the cookie that's like open with nuts on top. But she said they have like a whole bank of flavors.
Yeah.
Like imagine, all the goldfish come in like 20 flavors now, right? And it used to be one.
Yeah.
But and they test like the human, what the most popular. I'm sure you do the same with pets. It's the same concept.
We do, although you don't want to hang out at our flavor bar. That flavor bar that you just described sounds amazing. I don't think you want to hang out at ours.
That's right. Ugh.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
The other point I want to make that I personally experienced is cost. Now, for example, there was a drug that we used for an immune-mediated disease called Leukeran, brand name Leukeran, okay? And so I had a seeing eye dog in, and, you know, the owner worked, but, you know, she wasn't a gazillionaire, let's face it. And so the dog couldn't take one of the drugs that we normally use. So I said, well, we better try him on Leukeran. She came back for her recheck, $300. Leukeran 2 milligram. When I checked with Wedgwood to have it compounded, now here's the deal: if I need a dose that differs from that 2 milligram, I'm okay in ordering it from Wedgwood. Okay, that's what the law says. So he really did need a little bit of a higher dose. It turned out to be so inexpensive. So cost can always be helpful to the pet parent when some of these drugs, for example, gosh, when I was a pharmacist, colchicine was so cheap. I just looked at colchicine the other day. It's so expensive now. It's a medication used for gout. But cost savings with compounding pharmacies can be a real pleasure.
Yeah. I would think of price and cost savings as sometimes an unintended benefit.
Exactly.
If we look at the regulations around the compounding space, choosing a compounded alternative strictly for price or cost savings is a no-no. And we abide by that very carefully at Wedgwood. And honestly, any responsible compounding pharmacy should do that. Because a lot of times, if there is a copy being made just to reduce cost, chances are that cost is exactly where it is for a really important reason. There might be an inactive part of that drug that helps to improve bioavailability, or it may be that sourcing the raw material or raw substance from the FDA approved vendor is something that is costly for that manufacturer. So there's a lot of reasons that cost goes into a medication. That said, sometimes, especially in veterinary medicine, the dosing is different in the needs for pets, and that does end up driving down the price. So sometimes you will see that compounding is less, or in animals specifically, sometimes the raw material or the bulk substance doesn't need to be manufactured in a way that causes that price to go up in the commercially available for the human realm. So there's a few reasons why we would see price be decreased. The real value to me in compounding from a price sensitivity standpoint is that chronic care is really expensive. And that chronic care goes up if the medications are not effective because they're not able to be given effectively, or if we're unsure if the treatment is working, requiring additional diagnostics because you don't know if the medication even got into the pet. So where I see the most value from compounding from a price and cost sensitivity standpoint is if it's improving the adherence to the treatment plan, then that overall helps the cost of care go down. The other place that we'll see it is because there are times where the concentration is different or the amount that you need for the patient is different, and that in and of itself results in the cost going down as well. But it's a great point, and it's something that we shouldn't shy away from as a part of the conversation. I just wouldn't encourage any veterinarian or pet owner to seek that out as the only cause for going down a compounding path.
Well, and also as a layman pet parent, I always ask the veterinarian, now it's 2 cc's. Can you show me? They give you that thing. Because first of all, I'm raised in the United States. I'm not used to the cc's, the milliliter. It's just not my world. And so I will always ask, are you sure? And they give you that syringe thing. And I'm like, it's this line. I always verify it because I don't want to screw up. Because I'm from the sister, right? Yeah.
Well, so that's another really one that can play into cost, right? Like if you have an actual applicator device that's giving the exact amount that you want, the result is that often you see less waste of medication, which say it puts money back in your pocket over time. But also it improves with the accuracy of treatment, which is a huge reason why people come to Wedgwood Pharmacy. So we have applicator pens that are meant to be easy to provide accurate dosing. So so that's what I'm referencing when I talk about packaging. We also, another thing I'm really proud of is our team just released a new formulation of an eye medication called tacrolimus. It's for immune-mediated conditions of the eye. And one of the biggest pieces of feedback that we got is that, man, it's really hard to squeeze the bottle. And when you squeeze the bottle, what comes out causes frothiness. And then the animals are like, they don't like those bubbles in their eyes. So they're getting away from you. And then drops are going everywhere. So we reformulated it to make sure that the viscosity of the medication was less irritating to the eye and easier to come out of the dropper. And we've gotten very positive feedback. But that process took us 6 months to do, because in order to change that viscosity, we had to make sure that the drug remained active and that it was in the appropriate concentration and that the appropriate amount was coming out of the dropper. And so all of these things are things that go into compounding. And again, if you're finding a compounding pharmacy, they should be looking into all of these things for any medication that they're releasing. But packaging has a huge piece of it.
Oh, yeah.
So I have a question. Are when you compound a drug, I don't know, for whatever treatment, is it FDA approved then? Like, how does that work?
Yeah, so no. They finished good.
Because you're changing the original, right?
Right. Yeah. So what is required by regulations and the governing body, so the state boards of pharmacy are who regulate compounding pharmacies. The FDA regulates compounding pharmacies if they have what's called a 503B facility, which Wedgwood does. We were the first veterinary compounding pharmacy to have a 503B facility, and we have 2 of them. Now, the FDA regulates what's in the 503B, and we have to, we produce and distribute medications from that facility, and we follow the same good manufacturing policies and procedures that are required for human compounding and those in that facility, which is really great. FDA comes in regularly and audits us. We welcome them. It's something we're really proud of. And again, any compounding pharmacy should do that. If it's a 503A pharmacy, meaning that they're making personalized medications for a patient, that is not regulated by the FDA, but it's regulated by the state boards of pharmacy. So if we were to get a prescription in and ship it out to any state where that medication is going, has a right to come in and audit us and make sure that we are following their requirements. Now, compounding requirements, we have to use FDA registered bulk substance. So the bulk substance that we get, the raw materials essentially, come from FDA registered providers, and that comes from FDA approved processes. But putting it into this different form doesn't go through the FDA process. And so that's the key difference between the two.
And Janet, that is a key difference, because I want to give you 2 examples. Ketoconazole, an anti-yeast drug, I would have owners bring in their bottle, amber bottle. So that's 1 point for the compounding pharmacy. It wasn't Wedgwood. It was just someone up the street that compounded it. Okay. The powder of the drug was at the bottom. The liquid that it was supposed to be suspended in was at the top. There was no shake well on the bottle. So if this owner is pouring this liquid and giving it to the dog, well, they're not going to get any drug at the top, but they're going to get an overdose of the drug at the bottom, because all of it's at the bottom. The other example and my point is, it really is an art to compounding. You have to know what drug is soluble in what liquid, okay? And I think Wedgwood does a great job of that. My other example was a dog that saw me as a dermatologist for skin, but it was on 5 different cardiac meds. And I said, oh my goodness, you must be medicating all day. No, the pharmacy put them all together in one bottle. And you know, Ray and Janet, I'm going to tell you right now, the chance of all 5 drugs being A-compatible and stable is nil. And of course, I had to sit down when I heard that one. And I said, we need to have a talk. But that was I'm sure that still goes on, but that was in the bad old days before professional art of compounding places like Wedgwood became known to all of us veterinarians. That back in the day, my cat won't take this, and they would just, the neighborhood drugstore, and I'm not criticizing because I worked at a neighborhood drugstore, but they wouldn't do any research to find out what liquid is this drug compatible with and for how long is it stable. It may not be effective after a week.
That's exactly right.
So I commend Ray's people there because they do a lot of background research and publications as to what drug mixes with what and what it doesn't mix with.
That's exactly right. Yeah.
That was one of my questions, is how do I know when the drug is expired?
Yeah. So compounding is also really interesting. So there's a group called, the acronym is USP, which is something that it's a really important organization because they have dedicated their organization to the safety and increasing the odds that a compounded medication will have the intended effect. So really important. Notice I'm not saying that it will be efficacious because that's an FDA
Right.
approval process, but that it will have the intended effect that the caregiver has when they're prescribing. And so USP has put together really clear guidelines that help compounding pharmacies put procedures in place that will make it exceedingly likely that things like sterility, stability, etc., are going to occur in their compounded medications. Now, about 2 years ago, the FDA started something called Guidelines for Industry. GFI 256 is now something that a lot of compounding pharmacies talk about. And GFI 256 helps compounding pharmacies stay compliant with these regulations and recommendations that come through from USP. So, if you're a pet parent out there, you're like, how do I know if my veterinarian is partnering with a really good compounding pharmacy? These are really important things to ask or look for. There's something called PCAB, PCAB, PCAB accreditation, following USP guidelines, being GFI 256 compliant. These are all important phrases that you could ask about and look into. And chances are, if a compounding pharmacy has those things, that accreditation, those specific guidelines and regulations that they're following, if they're audited by the FDA and their state board of pharmacy, and if they're veterinary specific compounders, odds are they're going to do a really good job for your pet, which is super important. But to answer your original question, how do I know about expiry or expiration? In compounding, we have what's called a beyond use date, or BUD. And BUD is set by USP regulation for different vehicles. So for oils, it's different than it is for aqueous suspension, than it is for sterile. And so USP gives us those as a compounding pharmacy and says, unless you invest in your own stability studies, these are the requirements you have to have, and we post those on our label. Fun fact about Wedgwood is that we invested a few years ago into our own analytical lab so that we can check the concentrations, we can verify that the bulk raw substance we have is actually what it should be, we can check potency, and we can also do our own stability studies. And so if we have a really popular product that it's helpful to veterinarians or pet owners to have it on hand for a year before it expires, we'll actually conduct those stability studies. But that requires a hefty investment from the pharmacy, and it literally requires that medication is sitting in that dosage form, and every day they're looking at it and they're testing it to make sure that it is stable, remains sterile if that's appropriate for that medication, etc., for the period of time that we put on the label.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So I have another question.
Yeah.
So I go to the vet, I go to my veterinarian and says, you need this drug for Libby, and it's going to be at a compounding pharmacy, and I'm sending you to Wedgwood. Then what happens?
Oh, well, so we also have an online purchasing platform. We actually partnered with a company called Blue Rabbit, which is essentially an online pharmacy platform that has a great technology solution to allow you to purchase compounding medications. So we merged with them a couple of years ago, which was really exciting, and brought us an expanded offering or ability to get these medications to the homes of our clients and patients. So this can now be shipped directly to you, which is awesome. And then our medications are available on other platforms as well. So if certain medications that you purchase that are compounded on Chewy, for example, come from Wedgwood Pharmacy. If you veterinarians work really closely with online pharmacies like VetSource, VetCove, they distribute our medications through those as well. So we do our best to be wherever a veterinarian is ordering for one of their clients. We do our best to be there, so it's really easy to get those medications. And we do that because it's the right thing to do for our business, and also because we believe our compounded medications are the best, and we want to be where people need us.
And how quickly can I get that drug?
So it depends. If you are getting something that we make a lot of and we pre-package it because we know we're constantly getting orders of that. Yeah. So for example, our transdermal methimazole, which is a really common medication for cats with hyperthyroidism, one of the most common, actually the most common endocrine conditions in older cats. We have a great transdermal for that that's very popular. That's something that we call that pick, pack, and ship. So the moment the order comes in, we pull it off the shelf, we put it in the right packaging, we send it out. We do that on average in about 1.2 days from the moment the order comes in to the moment we get it out and shipping. And so our average time to customer is 4 days. Currently, we're working really hard to try to get that down to 2. Wow. If you are ordering something that is very customized, meaning that it's a flavor that we don't often do, or it's maybe a dosage form that's a little uncommon, or it's a combination and we need to look to see if that makes sense from a pharmacist standpoint, then you could be looking at more like 7 to 10 days.
But boy, that's fast.
That's still not
I wish J. Crew were that fast.
I know.
I want it now.
Can you, is it legal to compound controlled substances?
It is. So we we also get audited by the DEA. We have very specific licensure for DEA, and there are our most common controlled substance medication that we currently prepare is gabapentin. So we have a nice combination of gabapentin with trazodone, which is really makes getting your cats to the vet much easier.
Yes, right.
It's a really common one. We have a delicious chew with a little catnip flavor that cats that makes those visits much less stressful. And then
That's wonderful.
buprenorphine, we actually have
Yeah.
a buprenorphine version that lasts longer in the blood of animals because of the dosage form that we've put it in. And so it's also really great for cats, especially post dentist or something like that. For,
Right.
it helps to reduce pain from a procedure for longer. And so those are our two most common controlled substance medications that we have.
Are there any epic fails? Like a flavor or do you see what everything sounds so great and fabulous, but there has to be some that you kind of learned from, right?
Yeah. Well, so a couple of things that I would say epic fails, generally speaking, in the compounding world, and this is coming from me as a veterinarian who wants to help my colleagues, is there's a lot of fear around what if I choose compounding and I'm not allowed to legally? And
Oh.
that to me is a fail because if veterinarians aren't
Mhm.
comfortable and they're not
Yeah.
choosing the best option, and then that's affecting adherence or outcomes of patient care, that to me is a failure.
Yeah.
And so that's a
Yeah.
big part of what I have a lot of
Yeah.
passion around at Wedgwood is how do I help veterinarians feel really comfortable
Yeah.
around this is the time? Because if a commercially
Mhm.
available option is there and it suits the need of your patient, absolutely 100% you should prescribe that. But
Yeah.
if you're starting to go extra label, meaning you're not
Mhm.
prescribing it exactly the way that it was intended to be used or studied to be used, that's the moment you should and can start thinking about compounding and weighing the risks and benefits of
Yeah.
modifying that commercially available versus a compounding medication. So to me, that's a big fail is how do we
Yeah.
educate the
Yeah.
profession and pet
Yeah.
owners who are
Yeah.
struggling to give medications on, hey, this is an option and here's when it's really, really reasonable to think about it.
I
And
only
I think it's stressful for some pet owners. You know, Janet, when Dr. Hutchins was talking about methimazole for hyperthyroid cats, that normally as a pill has to be given twice a day. You might get the morning one in, but oh geez, I've got to get that second one. I'm already in bed,
Yeah.
and if they and people I've talked to that have hyperthyroid cats had no idea that methimazole could be made into a transdermal form, which they just
Oh my
put on the
God.
ear.
Yeah.
It's like easy peasy. And that's why I wanted to have Dr. Hutchins on today because pet parents, there's an easier way out there. You just kind of need to ask
Yeah.
questions of your veterinarian and don't ever condemn yourself that, oh, I just can't get this medication in. It's not your fault. There's various reasons. You might have arthritis in your hands.
Yep.
You can't open, or that pill is so tiny, you can't give it to the cat. That's when Wedgwood and Dr. Hutchins come in handy because we can make that happen for you.
We can. And I mean, veterinarians, we swore an oath to protect our patients, first do no harm, protect our patients, protect that human animal bond. And sometimes there's a tension when we diagnose a disease because we know that we
Yeah.
need to treat that disease, but sometimes treating that disease results in a rift between
Yeah.
that patient and their family. And compounding can often be a way to close that gap. And it can actually make treatment a pleasurable experience.
Yes.
Like if it tastes like a
Especially if
treat.
it's
Yeah,
flavored.
exactly.
Yeah.
They're like, give me that marshmallow flavored treat. I'm here for it.
Well, we had a diabetic cat, and I'll never forget when they said, "Well, you're going to be giving the insulin twice a day," and I was like, "Oh my God! Like I don't even know how to handle a syringe, right?"
Yeah.
And the
Yeah.
12-year-old assistant goes, "Oh, I got you," and I'm like, "Really?" And the next thing I know, I'm shooting up the cat, but I had the whole
Yeah.
family trained because I didn't want to be the only one that had to be around in the morning and the afternoon. And
Yeah.
she was cool with it, but right now I'll tell you, the two cats we have now, I don't think that works so well. That ear swab thing sounds great.
Well, there's new things out for diabetes in cats. You're lucky, Janet.
Yeah.
Hopefully they won't
I know.
become that.
Listen, the future is feline, as I like to say. There's a
Yes.
lot going on for cats, which warms my heart.
Oh wow! Now tell
I
me.
want to ask Dr. Hutchins about these two beagles that I've seen pictures
Oh,
of.
you have beagles.
She's a beagle mom.
Yeah,
They
so
are howlers.
oh, they are, but the Hutchins hounds are
The
they
Hutchins
started
hounds.
us. So my husband and I both grew up loving beagles, and then we adopted two beagles, which were they were our heart dogs, Sally and Isaac, and so Sally came actually from a pharmaceutical research facility.
Oh,
And
God bless
she
you.
just had the best disposition. And Isaac was rescued from a hunting colony in North Carolina, where we're from. And they just, they filled our home with a lot of terrible yeasty smells and a lot of sounds. But just so
I can
much
see you're
joy.
mixing up the ear medications for these.
But just so much joy. And so Sally and Isaac were, so much of the time when I was prescribing treatments or putting myself in the shoes of families, Sally and Isaac taught me all the lessons of what is hard and what is joyful, and how do I think about that when I'm talking with families. They were the best. They were the
I hear
absolute
you and your
best.
husband. Do you take these beagles to be your
I know.
your married pets?
Hey, you know
Sally,
what?
she was the ring bearer in our wedding, so yes,
There
that
you
was
go.
Oh,
she
I
had a very
love
important
that.
role.
Oh.
And she listened.
Exactly.
I really think, practicing in Ohio, I really think that the breed Beagle is the most found dog, because I had two clients that lived in kind of central Ohio. She had four Beagles. I said, "Oh, where did you get them?" They just showed up at the house, because the old thing is this dog won't hunt.
Yeah.
And they just leave him out in the country somewhere. I had literally two clients that had four Beagles each, and one of them had horrible bladder cancer, and they just took such great care of her. And God bless them, because a Beagle, I always say, there's nothing like a Beagle. Gotta love a Beagle.
Yeah, they're just the best. They're the best breed, and they get a lot of really strange conditions. It turns out, which when you're
Yeah.
an internal medicine specialist, it's great to learn from those experiences.
Yeah. Now, what about the chicken?
Oh
Oh, you have a chicken?
So now we are, we have a farm, and the chickens they rule the house. So we have 14, and
They're bossy. They're
Yes.
very bossy.
Really?
yeah, we have 14. We just got, we have 6 that are very, very young little chicks. And then, the rest are older, and they've been ruling our home for over 3 years now. And so, we are a full-fledged chicken family. Like, we took family photos a year ago, and we had chickens in our family photos. I mean, and Ruby is our favorite. She is, and she knows it. Oh, everything that she does makes it clear that she knows that she is the
That's a
favorite
lot
of
of
the flock.
eggs. That's a lot of eggs.
Does Here, Janet, think about this. Does every veterinarian that lives in North Carolina have a farm? Because Dr. Brightshort had a farm too.
Well, I
Is that
learned
like a
lot from him,
prereq?
so
Oh, you're out.
Right.
It's probably like out in the country.
yeah, we grow a lot of produce, and then those girls, they're out there fertilizing it, the chickens,
girls.
and giving us a lot of eggs.
Do
We love 'em.
Do they have a cute hen house?
they
I love
do.
cute hen houses.
Yeah,
Oh.
they have a hen house, and they have poultry. We let them range, except for we have a lot of, there's risk of predators, so that we have a lot
Yeah.
of protection
Yes.
around them. I mean, they and I show them love with food, so they're way too fat, but that's okay. I love
yeah.
them so much.
Yeah.
It's so
Food is
funny.
love.
Ex-
Do the beagles get along with the chickens, or do they go after them?
No, they're separate. They're fine. Yeah.
Oh, they stay
Yeah.
separate. Okay.
Yeah.
Can you imagine my cats?
Oh, Janet's cats are like ready at any given moment to jump on anything.
Well, and it's been so cold. It was like 0 degrees,
Yeah.
1 degree here, and we couldn't let them out. And honest to God, the whole house shook with row,
Yes.
Yeah.
because they wanted to go out, but we couldn't.
Nothing
we were
worse than
terrified to let them out. Now
Frustrated cat.
it's like 38, so we've been letting them in and out a little bit.
How old are they?
Yeah.
And have they always been together?
They're siblings, a brother sister, Atticus, Catechus, and Isabel, and they are going on 6. We got them during COVID because I let them outside. They're like our resident Orkin people.
Yeah.
They're cats.
She has a chipmunk problem.
And I found out we have flying squirrels because there were these tails that I
Yeah.
didn't know what it was. And it's like a
Yeah.
feather. I didn't know what it was. I literally did Google Lens, and I'm like, oh my God, we have flying squirrels. So they're wonderful, wonderful cats.
Oh, that's
They
wonderful.
just do their work. That's
Yeah.
their job.
I was chuckling when Dr. Hutchins was saying, Janet asked about horses. And I just pictured Dr. Hutchins and myself when we were doing equine medicine, and you had to give the sulfa antibiotic to the horse. There's a big mortar and pestle in the horse barn with a big jug of molasses.
Yep.
And we're all grinding these, which sulfa meds taste so horrible. I remember my cat was on a sulfa med,
Yep.
and as I always tell people, you'll get the first dose in, and then I would walk in the room with the prescription vial.
Never
the cat
again.
was out of there. That's right.
Man, I'm allergic to sulfa.
That it comes back to you. I totally get it, Janet. Always comes back to you. But I'm just saying.
Did she say sulfa?
Yeah, for Wedgwood, wait, it's about me. I'm allergic to it. For Wedgwood to be able to mask that taste, when I was in pharmacy school, we made peppermint schnapps in pharmacy lab and fun stuff.
For the
but we
humans.
could
For the humans, people. We want to make it
Yeah,
clear.
we had to taste test. But let me tell you this, we could never mask the taste of potassium chloride. No matter
wanna
what we
taste
did. It was a horrible flavor. And I picture sulfa drugs like that too.
It's very possible. I mean, gabapentin is one of the most bitter active ingredients.
Oh,
So
yeah.
it's very,
Really?
very bitter. So it's
Yeah.
and it's interesting because different flavor profiles will mask it. We had peppermint is also a very common flavor in the equine
Oh.
space, and so we have
Oh.
these are the types of things that we play with, honestly, to see, and so it doesn't surprise me that you are
Wow.
playing with some of those things.
Yeah, well, long time ago, but that had to do something for fun in pharmacy
Yes.
lab, you know.
Alex, we got to ask Dr. Hutchins our questions. What is your
Okay.
pet or human peeve?
It could be something little. It doesn't have to
It could
be
be
even
something. It
dealing
could be
with
about your husband or the chickens.
yeah,
Or,
the chickens.
you know, like people don't put their blinky on.
It better not be about the beagles though, because
Yeah.
Yeah. Okay.
'Cause we
So
love
I'll,
them.
since you said that my husband does fair territory here for me.
Oh,
Hope you're listening, honey.
hi, honey.
He's kept me around for over 20 years, so I feel like this will just
Oh, yeah.
But
No,
That's
you
right.
kept him around.
That's it.
I like to call it man looking, where we'll say, "Hey, you need to go grab so and so. It's in the pantry," and then I hear,
Oh,
"Oh, it's
oh,
not there." I'm
oh,
like, "Well, did you man look or did you look?"
Don't make me get up. Don't make me get up. Janet lives with 3 men. It's horrible. Yeah.
Well,
Let me
I-
tell you.
I have 2 boys.
Wait, here's
and
my
then- and so-
favorite.
yes.
Okay.
Where's the ketchup?
Yes.
And I know it's in the
Don't
right
make me get
drawer
up
on
off
the
this
bottom
chair.
shelf. Like this. Where's the ketchup? That's my
I know.
favorite question.
Wait, before they even open the door.
Right. Right.
So you have 2 sons, Dr.
I have
Hutchins?
2 sons. Yeah.
So Janet, same
Same thing.
household as you.
Yeah.
Yeah.
Thing.
Yeah.
And the where's the ketchup? It makes me nuts. Or the other,
both of you.
where's the remote?
Yeah.
And then they get pissed when I'll be watching. We have Apple TV. Hold on, I gotta let the dog out. Hold on.
Okay.
Okay, go see. Go. Oh, wait. We have the Apple TV thing, and so
Yeah.
they'll be like search and search and search and search, and still search, and I'll go like this on the side of it. Find
I
in the
know.
afternoon. Bam.
No, or I like when I'm trying to get to sleep and I hear click, 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 and I'm like, okay, 2 more. Click, click, click. Stop it.
Oh no, I hear the laptop next to me,
Oh, yeah.
and I'm like, get out of here.
Yeah.
Yeah, right.
Oh, can you hear that? I'm like, yeah. Wait, now she's coming back in.
Okay. Well, anyway, I just can't thank you enough for being on. I just want everyone to know compounding pharmacy is such a fabulous service. It really takes up the reason for I can't give this to my pet.
Oh, yeah.
Yes, you can, because we can make that happen.
That's right.
Because as Joe pet owner here, when they give me a drug, I'm like, how is it going in?
But that's to me the question that every pet owner should ask. How can we make this easier? Because the fact
Yeah.
of the matter is that, again, you have to find the right compounding pharmacy. That's really, really important. But if
Agreed.
your veterinarian is partnered with the right compounding pharmacy that is following all the guidelines and regulations, then they can help you find solutions. And it doesn't have to be hard. It doesn't have to be
Or
hard.
expensive.
Yeah.
Or expensive.
that's a good-
In
that's
many cases, it's less expensive.
Yep.
Yeah.
Yeah.
Well, thank you so much. This has been a pleasure. I sure learned a lot as Joe pet owner.
Wait till you see those beagles, Janet, because I've got pictures.
Well,
of
here,
Dr.
I've got
Hutchins
a
and the
golden.
chicken.
Come over here. Come over here. Where are you? Hold on. Here's
Mine I was petting now that she's gone.
There's
Oh,
Libby.
hi, Libby. Hi, Lib.
She's glued to me.
I should go get
Yeah.
one of the girls from the flock. I mean, if you could see Ruby right now.
Oh, I would love that.
So I have a question. Are you a Pi Phi?
Am I a what?
A Pi Beta Phi? Because
Oh,
you have an
no.
arrow.
No.
Oh, okay.
No, the arrow is actually because my mother's maiden name is was Archer, and so I
Oh,
have
cool.
so I have little Archer signs. All
Oh,
over.
that's very cool.
This is just $38 from Spartina. It has no meaning. No, apparently it means, wait, it's meant something, like truthful or I don't even know, whatever. But
You're a riot. I love talking with you too.
well, we're a lot. Let's put that. We're a lot. When we're the four of us are together, like because the only place we go are animal fundraisers. So because veterinarians, we can't talk to anyone unless
Yeah.
it's about animals.
Yeah.
So when the four of us are there and Janet and I have had a cocktail or two, our husbands they just leave us because they're
Like,
embarrassed.
we're out of here.
Yeah. I got yelled at for talking to the cashier in the quick line today. She was telling me about this restaurant, and he's out there like starting the car.
He's like, I'm done.
We can't thank Dr. Hutchins enough. I just love hearing about compounding because anything that gets the medication into the pet, I'm all for. What about you, Janet?
Well, and eases the angst of the pet owner.
Yeah, exactly.
So thank you for
Both-
the great work you do. We appreciate you, and thanks for joining us.
And thanks for adopting beagles.
Well, thanks for having me. It's been a true pleasure, and I hope it was a helpful conversation.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hey, thanks for watching.
And listening,
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
This episode of Speaking of Pets has been sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game. The Speaking of Pets podcast is an SLA Video Production.